So good morning, good afternoon, good evening to all of you. Thank you for joining on time. Welcome to our Climate Change and Nutrition Pathways in the Asia Pacific region webinar. We're happy to have you here. The webinar will be recorded. It's already in process now. As you join, please feel free to introduce yourself in the chat, who you are, where you're listening in from, so we know who we all are on this call. Just a few notes to please keep your mics and cameras off to save on bandwidth. If you have any questions, please feel free to post them in the Q&A box. We will be monitoring that box and we'll work to answer all the questions that you pose to us. If there's anything outstanding of the questions that you ask us, we will make the effort to make sure that they get answered after the webinar. Let's move on to the next slide. We are very thankful for the support from Separatech for providing interpreters for today's webinar. Today we have 𝗖𝗵𝗶𝗆𝗆 in the French channel, 𝗖𝗵𝗵𝗴𝗲𝗃 in the Spanish channel, and 𝗔𝘀𝗶𝗆 in the Arabic channel. Thank you very much to all of our interpreters. You'll see on the screen how to access that interpretation, but you're going to be looking for that globe icon. Click on that and then select the channel in which you would like to listen to the webinar. Next slide, please. The webinar is jointly organized by the GNC and members of the Climate Crisis Working Group. We have Dakota, Save the Children, World Food Program, and UNICEF together today. And you'll also see the logos of the donors to the Global Nutrition Cluster, without which we would not be able to deliver this webinar. So thanks to them. On to the next slide, we have our agenda. We'll start off with a quick welcome and a scene setting. Then into our first presentation on evidence. We'll take a little break for a short poll and then get into a case study from Vanuatu. And then we'll have a good chunk of time for the Q&A session and moving on to the next steps. So up next, I'll hand over to Andrea Berardo, who will take us through the scene setting and the framing of why climate risks matter for nutrition. Andrea is the head of research, assessment, and monitoring at the Regional Bureau for Asia and the Pacific of the World Food Program. Welcome to Andrea.
Thank you very much, Miriam, and thanks to the Global Nutrition Cluster for this opportunity. I hope my sound comes out well. With this assumption, yeah, let me start. The question that you can see on the screen put together two concepts that at times are considered together by some agencies, and at some point or another time by other actors, they are considered as two separate concepts. Now, where we are here talking about nutrition, we are indeed in this webinar organized by the Global Nutrition Cluster. And we all know that nutrition is part of the focus of the World Food Program. But also part of our focus is how to not just analyze, which is let's say the area for which I'm responsible for, but how to intervene with food security intervention that could be sensitive to the climate, to the changing climate and the climate challenges that we are facing, and hopefully having an impact on nutrition. So that was a question that we had in mind for a while, and I'm sharing you a little bit of the background of this question, because indeed a couple of years ago, together with some of the research partners that we'll speak to today in this webinar, we try to explore let's say the situation on these two areas, and particularly for Asia and the Pacific. So one aspect is the nutrition aspect. I'm sure I'm not sharing anything new for anyone on the call here, but nutrition in the Asian Pacific region is quite challenging. The region has amongst the highest prevalences of all forms of malnutrition in the world, with persistent high level of undernutrition and a rapid, alarming rise in overweight, obesity, and non-communicable diseases. So a lot of challenges there for many of our organizations and for the countries, first and foremost. But from the other side, UNDP in a 2024 report called climate change a profound existential threat to the Asian Pacific region. They talk about disaster, climate related disaster, annual losses, economic impact. But so we were wondering, this group of researchers that set together a few months ago, and we were wondering, what is the link? Is there any link, or is there a provable link between phenomena related to whatever is happening to the climate and the changing that the climate is having, and the economic impact of that, going into nutrition? So what are the links? And even more important, what are the pathways where we could intervene in the two domains to try to help each other? No? So the idea was really to put together an overview of the evidence that was available. So the idea usually starts with a literature review and a limitation of the information that we actually have. But also what we needed to focus was on the next step. Now, what are the pathways that we could identify to intervene, opportunities that exist for the integration of climate change and nutrition in adaptation strategies and interventions. So we are going to share with you all an analysis that we thought it was going to be quite helpful for WFP. But I hope that the participant to the webinar will find this analysis informative and useful for a wider range of partners. They are working specifically in nutrition, as I assume many of the participants will to the webinar will be, let's say, coming from as a background. But even more on climate-related issues, disaster risk reductions, and anticipatory actions to see how we can work together or how we can influence the work in that area for an improved nutrition outcome. So the research was challenging. I can put that up front with my colleagues that will let's say explain how the research went about and to identify these areas. So without further ado, I'll put up the questions there. No, we had questions and we wanted information, if not definitive answers, but we wanted directions, no direction for further research, which is something that is always an exciting topic for all the researchers around the table, but also ideas and recommendations that could be operationalized to have an impact on nutrition. So we found an incredible, valuable partner with 𝗔𝘀𝗶, and now I'm going to hand over the next session to Mari Skarmanger. Mari is a public health nutritionist with more than 20 years of experience in global nutrition across research, policy communication, and advocacy, with a particular interest in maternal, infant, and young child nutrition. She is the senior researcher and deputy director of 𝗔𝘀𝗶, and 𝗔𝘀𝗶 is the research partner to which we committed this research, and from whom we were quite eager to get ideas and innovative ideas to have an impact on nutrition, but coming from a longer, far away of a climate change. So Mari, with this introduction, it's my pleasure to hand you the floor. Thank you.
Thank you, Andrea. Tēnā koutou and greetings from the South Pacific, and a warm welcome to this webinar on behalf of 𝗥𝗂𝗁. My name is 𝗔𝘀𝗶𝗆, as Andrea said, Deputy Director and Senior Researcher with 𝗥𝗂𝗁. I'd like to acknowledge my colleagues Chiara Cresta, Rebecca Brooks, Christy Smith, and Dakota Director Sophie Goudet, and of course 𝗣𝗵𝗵𝗆 for their contributions to the work I'm presenting. Also a big thank you to Save the Children for joining the webinar to present very recently collected data from Vanuatu. Next slide, please. I wanted to start with what we know. Climate change will increase the prevalence of undernutrition in the Asia-Pacific region. Predictions by 2050 are that an additional 11.2 million children will be undernourished, an additional 2 million children will be stunted, an additional 44 million disability-adjusted life years will be lost due to nutritional deficiencies, and more than 400,000 will die climate-related deaths in the Asia-Pacific region. Next slide, please. So why pathways? Asia-Pacific faces a triple burden of malnutrition, with high levels of child stunting, micronutrient deficiencies, and a growing overweight and epidemic of overweight, obesity, and NCDs. Climate change is an accelerant. It disrupts food, health, and social systems and deepens inequities if we don't act. Addressing this crisis requires a pathways approach, one that recognizes interconnected systems and supports multi-sectoral responses, integrated financing, and joint indicators. Pathways connect interventions across agriculture, WASH, health and social protection budget, and makes it easier to line up multi-sector funding. Stress testing and action across systems, for example, irrigation to water quality to diarrhea, avoids nutrition gains being wiped out elsewhere. A shared lens prompts metrics that capture both climate and nutrition benefits, for example, protein delivered per kg of CO2 equivalents avoided, so teams can report to donors with one scoreboard. Visual pathways show which ministry controls which lever and what co-benefits they gain, improving ownership and implementation. And it has built-in backups. If one system fails, for example, if roads flood, another pathway, cash safety nets, can still protect diets. Next slide, please. So climate nutrition pathways at a glance. This is simply linking climate drivers to nutrition outcomes. Climate change impacts 4 key systems: agri-food, health, water and sanitation, and social protection. These disruptions can accelerate multiple forms of malnutrition. Undernutrition, especially among children under 5 and pregnant and lactating women, micronutrient deficiencies, and as mentioned, obesity and NCDs. Next slide, please. This slide shows all this put together in one diagram, building on existing frameworks and informed by regional research and consultation. The intent with this framework was to help identify entry points for coordinated action and triple duty interventions. These pathways occur on top of existing vulnerabilities and burdens of all forms of malnutrition, and in the Asia-Pacific region, with a backdrop of reliance on imports, rapid urbanization, and nutrition transition. And the framework acknowledges that the impact of climate change on nutrition will not be felt equally. Next slide, please. So because the previous slide was very busy, we'll now go through each pathway of the framework one by one, starting with the agri-food system pathway. This is about food production, access, and diets under pressure. And it's quite hard to do all of this in one slide, but we'll try. Climate risks, such as heat waves, droughts, and floods, will lead to lower yields of crops, nutrient losses in crops due to CO2, price shocks, food safety risks, food loss and waste, loss of livelihoods, and also affects livestock and fisheries as well. Market volatility limits access to diverse and nutritious foods, especially in urban areas. And the evidence base is strong. However, gaps remain in sub-national price and diet quality data. As a spotlight for the Asia-Pacific region, by 2030, 75% of coastal fisheries in the region are projected to fall short of food security needs due to population growth and climate change. And when it comes to the cost of a healthy diet, climate change is projected to increase the cost of a nutritious food basket by 10% by 2030 and 20% by 2050. Next slide, please. Moving on to the health system pathway. So this is about climate risks to health services and to health outcomes. Extreme weather, disease vectors, and service disruptions will impact maternal and child nutrition. Climate events can worsen chronic conditions, reduce immunization coverage, and increase birth risks. And there is strong evidence on service disruption and undernutrition, especially the impact of heat on birth outcomes, but links to obesity and NCDs are emerging and are under-researched. As a spotlight, we, from the Solomon Islands, very recently collected data. Communities reported flooding and storms often damaged health facilities and or supplies and damaged roads. And this disrupts access for the communities. And the communities were increasingly relying on outreach health services. Next slide, please. Onto the water system pathway. Water is a foundation for nutrition and resilience. Climate-related salinization, contamination, and scarcity reduce agricultural productivity and hygiene practices. And waterborne diseases, such as diarrhea, directly impact nutrient absorption. If we pull all this together in one example, on sort of focusing in on saline intrusion in low-lying atolls in the Pacific, such as Tuvalu, Kiribati, and Vanuatu coastal islets, we have the climate trigger of saline intrusion being the rising sea level or storm surges, often combined with drought, where seawater intrudes shallow groundwater and taro pits. Immediate water impact is that household wells become brackish, and WHO salinity and E. coli limits exceed, and diarrhea spikes. The food system hit is that loss of fresh water kills taro and swamp crops. Nutrition knock-on is that households switch to imported, nutrient-poor, energy-dense foods, leading to, over time, a higher risk of anemia and potentially NCDs. Response gaps is costly desalinization, limited rain tank coverage, no saline-tolerant crop programs, or no programs for preserving or processing saline-tolerant crops when in season. A pathway lesson is that this single hazard disrupts wash, agriculture, and diet quality simultaneously, requiring integrated water harvesting, crop diversification, and nutrition-sensitive disaster plans. Next slide, please. On to social protection and anticipatory action. In the absence of adaptive social protection, households adopt negative coping strategies, such as skipping meals, cutting food groups. And examples of promising action have been shown in the Philippines and in Bangladesh, either with anticipatory cash transfers before typhoons in Philippines, or in Bangladesh with cash top-ups for nutrition during floods. And to expand on the Bangladesh example, mobile cash transfers were given to vulnerable communities prior to floods in 2017 and 2019, and were shown to result in higher food consumption, with 36% of households less likely to go a day without eating during the floods, and higher consumption measured 3 months afterwards, as well as lower levels of asset loss, less costly borrowing coping strategies, and lessened psychological stress. Illustrating that greater investment is needed in predictive, nutrition-sensitive social protection systems. Next slide, please. As mentioned at the beginning of the presentation, it's very important to have a cross-cutting equity lens because climate and nutrition risks are not felt equally. Marginalized populations such as women, youth, people with disabilities, and urban poor face layered vulnerabilities across all pathways. And gendered roles influence food production, consumption, care, and decision-making. In the agri-food system, climate-smart inputs reach men and landowners first. Price spikes hit households caring for persons with disabilities. Slum dwellers rely on informal vendors with high foodborne disease risk. In the water pathway, drought increases women's and girls' water collection burden. Inaccessible water points force households with disabled members to use unsafe sources, and flood backflow contaminates slum dwellings the fastest, or the first. Health, physically demanding work during pregnancy is associated with an increased risk of adverse pregnancy outcomes such as miscarriage, preterm birth, low birth weight, and small for gestational age. And in social protection and anticipatory action, we need to be aware that mobile cash may bypass SIM-less women. Disability really is really captured in targeting lists, and ID poor urban residents may be invisible to early action triggers. The bottom line is that each pathway can widen or narrow inequities, and we need to design safeguards for gender, disability, and urban poor groups from the outset. Next slide, please. So there are several interpathways, synergies, and some trade-offs. Multiple wins and some potential risks. Some interventions touch multiple systems. I'll give 2 examples here. Diversified school meals, touching agri-food and health. Breastfeeding protection, promotion and support, targeting all forms of malnutrition, and lowering greenhouse gas emissions. Some trade-offs exist. For example, animal source foods are associated with high greenhouse gas emissions, but are also very important, especially for vulnerable groups with high needs, such as children under 5 and pregnant and lactating women. And we need tools to map impacts and optimize co-benefits. Next slide, please. So priority data and research gaps. There is still limited data on the pathways for overweight and obesity, urban food security and obesity, maternal nutrition pathways, and integrated climate nutrition surveillance. And we need stronger interdisciplinary evidence generation that combines lived experience, cost of diet tools, and risk mapping. Next slide, please. So, to the action roadmap. Each pathway offers no regret actions and system-level opportunities. Strengthening local food systems, expanding shock-responsive safety nets, and climate-proof health infrastructure. There is a need to balance quick-win pilots with long-term policy and systems reform. And to align with WFP programming, each proposed actions can be mapped to existing WFP funding streams, such as for the climate risk insurance window, anticipatory cash with nutrition vouchers, the school feeding window, climate smart vegetable-rich menus, and water security goes with rain harvesting and nutrition and wash integration. Advocacy, it's important to frame the no regret actions as NDC, NAP implementation accelerators and feed them into WFP and nutrition cluster messaging ahead of COP30. There are concrete asks such as earmarking adaptation finance for double duty climate nutrition interventions and including nutrition indicators in global stocktake follow-ups. Next slide, please. We wanted to show the publications, one that is you can find on WFP's website, the Climate Nutrition Equation, Insights and Actions for Asia Pacific, and a manuscript that is under review with the Journal of Climate Change and Health, specifically on the pathways framework presented here. Next slide, please. And that's all from us. And I'll now hand back over to Miriam. Thank you.
Thanks, Mari. I really appreciate you going through those pathways. Really made it very clear. We're going to take a few minutes to get into a poll, so we can go to the next slide. While we're preparing for the poll, please do feel free to put your comments or questions in the Q&A box, and we'll get to those at the end of the webinar. Okay, so let's open our poll for today. So the question that is posed to you is, which system is your organization's main focus in the area of climate change and nutrition? We've asked for a main focus, so asking you to select one. The first one is food system. Second is health system. Third is water and sanitation system. Fourth is social protection and anticipatory action. Fifth is multi-system actions. And the last one is little or no focus on climate change and nutrition. I will let the poll run for a few minutes for you to insert your response. We have just over half of the respondents in. I'm thankful to see that there's only a few organizations that have little or no focus. But perhaps that's why you're on the webinar today, so that's great. You're welcome. Okay, just another few seconds and I'll end the poll and you can see the results for yourself. Okay, I'll close the poll and I'll show the results. Mari, if one of our panelists would like to comment on what you're seeing, if this is what you expected or not, I'll give a few minutes for you to unmute your mic and provide any feedback. And if not, we'll head into our next session. So food system definitely out front with multi-system actions as a close second. Health systems, social protection, anticipatory action coming in after that. No one indicating water and sanitation system, which is was surprising for me. And then 3 respondents indicating little or no focus, which we hope will change after this webinar. Great. Well, then let's move on to our case study. We have a case study coming in from Vanuatu. Tracy Ewan is going to take us through the case study. She is the Pacific Regional Health and Nutrition Technical Advisor for Save the Children Australia in Vanuatu. So over to you, Tracy. Thanks for joining us.
Thanks, Miriam. Good afternoon or good morning, everyone, depending where you are. It's wonderful to be invited to present the findings of our study from Vanuatu today. And thank you to today's organisers and the 𝗥𝗂𝗏 team for the kind invitation. So nutrition in the Pacific is a critical area of concern, especially given the unique challenges faced by Pacific Island populations. As mentioned earlier, many Pacific Island countries face a triple burden of malnutrition, including undernutrition with stunting and wasting, micronutrient deficiencies, and increasingly we're seeing overnutrition, including overweight and obesity. And while there are indications that climate change is going to have significant impacts on children's well-being, the evidence based on the linkages between climate change and nutrition is still quite limited for the Pacific, especially country-specific data and analysis. So Save the Children commissioned this study with support from the Australian government to help inform future programming interventions for us, as well as other actors working on food security and integrated nutrition programs in the Pacific, which hopefully many of you will take forward today as well. And we did this study in 3 countries in Melanesia, which were Vanuatu, the Solomon Islands, and Papua New Guinea. But today I'll only go through the findings for Vanuatu as part of this case study. We've also, as Marie mentioned, only recently collected this data in Vanuatu in April, so the findings are still quite fresh, and we will be publishing them in a report in the coming month. Next slide, please. So Vanuatu is a small Pacific Island country of about 320,000 people, spread out across around 80 islands and atolls, and it's about 1,700 kilometers or 3 hours flight from the east coast of Australia. It was ranked as the country with the highest disaster risk, according to the World Risk Index of 2020, with several hazards including cyclones, storms, flooding and drought, coastal erosion, and sea level rise. Most recently, it was also hit by a devastating earthquake in December of last year. The malnutrition rates are very high, with approximately 1/3 of children under 5 stunted, 1/3 with anemia, and the prevalence of overweight has almost doubled in the last 10 years to now sitting at nearly 10%. Next slide, please. So while our original study contained several interrelated research questions, today I'll mainly focus on just one key question of the study, which is how does climate change affect the nutritional vulnerability of pregnant and lactating women and children under 5, particularly looking at those in the first 1,000 days, which we also then examined across various urban, rural, seaside and inland contexts of Vanuatu. And while we had a desk review to initially indicate what could be some likely answers, we really wanted to understand the lived experiences and perspectives from the community on this issue. Next slide, please. We collected data from 4 sites representing a mix of coastal, inland, urban and rural communities. And we conducted focus group discussions with separate groups of mothers, fathers and grandmothers using a problem tree approach to guide the discussion. We also conducted community mappings with a mixed group of community members to look at a timeline of recent disasters, their impacts on resources, and any linkages to the health and nutrition of children and mothers. There were also a series of key informant interviews completed with 11 representatives from local ministries, NGOs, and civil society for their additional perspectives. Next slide, please. This is just a short slide to show what the problem trees look like, which were then compiled into a master tree on the right, which noted the main problems, their causes, and potential solutions, as well as the commonalities or differences between the different types of rural, urban, coastal areas. And the findings were then mapped against the nutrition framework, which Marie just presented. And today we'll really focus on 3 particular pathways that came out quite strong in the analysis, which was food, health, and wash. Next slide, please. From the food system, we saw a number of pathways where climate change is already creating harmful impacts. Climate shocks, such as cyclones and floods, were reported to have repeatedly destroyed gardens and fruit trees, also delaying replanting and reducing access to local nutritious foods. Not only would this impact dietary diversity and foods for child feeding, but in turn, the reduced and unstable production of local crops was mentioned as a contributor to the rising dependence on processed foods, such as rice, tinned fish, and sugary snacks. And of course, this is driving both undernutrition and overweight, especially in children and pregnant and lactating women. As one grandmother said, when there's a cyclone, it damages our bananas, taro, manioc, and green cabbage. Post-cyclone, there's no fresh greens and local root crops for families to eat. So children and mothers can only eat store-bought food like rice and tinned fish. And there's limited local food, so we rely on this store-bought foods. The slow onset changes were also noted, with saltwater intrusion and erratic rainfall causing similar reductions in traditional crops. One of the pathways that Marie touched on in her presentation, which I won't go into great depth today, was around social protection. So with this food system pathway, another interesting finding was that having frequent and repeated shocks were reported to erode the traditional cultural safety net systems related to food. So normally, families with reserves would share their food with others in the community in times of hardship. In the Pacific, there's a very strong reciprocal sharing culture. However, after 3 successive bad cyclones between 2020 and 2023, which included 2 back-to-back cyclones of Cyclone Kevin and Judy in 2023, the respondents mentioned that this was a year of selfishness, when they couldn't cook and share meals with their neighbours as much as before. Next slide, please. With the wash systems pathway, we again saw several ways that climate was leading to poorer nutrition. Extreme weather events were said to damage water and sanitation infrastructure, reducing access to safe drinking water and functional toilets during critical periods. Related to this, water sources are becoming increasingly unreliable and unsafe, not only from fecal contamination during the floods and storms, but also through saltwater intrusion and drought, which then encouraged more frequent illnesses, especially among children and mothers. In many cases as well, a lack of clean water became a financial burden, as households either paid to buy water or paid for transport to fetch water from rivers. And as a result, hygiene was often reduced, leading to a number of impacts. So that poorer hygiene was linked by respondents to increased child illnesses, including diarrhea and skin infections, particularly yaws, which is a neglected tropical disease that's unfortunately still very common in Vanuatu. And the need to pay for water also means that there is an increasing diversion of household resources going towards water that could otherwise be going towards food. In one urban community, they had noted that after cyclones, the water committees had instigated additional daily access fees of approximately 50 US cents per person per day, charged in order to access water. And this became a further burden to households in this time of need. Next slide, please. And lastly, the health systems pathway. So here, climate shocks again led to disruption, particularly of health infrastructure and supply chains, which limited access to essential maternal, child, health and nutrition services when demand and need is the highest. Health systems in Vanuatu are already stretched and fragile, particularly in rural areas, and participants reported that many health posts were only staffed by usually a single nurse or a volunteer, often without backup or regular supervision. This meant that when roads were cut off or clinics were damaged due to fallen trees and flooding, those services stopped completely. The communities described long wait times, reduced antenatal coverage for women, and missed child health checks during these disaster periods. In some areas, outreach and referral systems were also disrupted for extended periods, all of which could contribute to worse birth outcomes, missed opportunities for growth monitoring and vaccinations, as well as treatment of diseases that contribute to malnutrition. As reported through the WASH system pathway as well, there were reports of increased disease burden, particularly diarrhea, respiratory illnesses, and dehydration, brought about during floods and heat waves. And again, this exacerbates malnutrition risks for children under 5 and pregnant and lactating women. And again, told by another grandmother, when children are faced with these other sicknesses, it also affects their eating habits. They're less likely to eat and drink water. And if the parent isn't attentive and children don't want to eat too much, there's no pushback because it's just one less person to feed in an already overwhelmed family. Next slide, please. So what are the practical applications of these findings? In addition to helping expand the evidence base on the impact of climate change on child nutrition, this study also included a review of existing policies and programs, and together they've resulted in a number of recommendations that Save the Children and the sector can look to integrate into future work. Without going through them all, these included improving local food systems through scaling up of community food gardens, particularly with climate smart approaches, and prioritizing women and single caregivers as the most vulnerable, or integrating nutrition sensitive vouchers or basket schemes into existing cash transfer programs. Through health systems could embed climate adaptation clauses into health plans to improve the continuity of nutrition and health services during shocks, such as triggers for mobile outreach clinics and surge staffing after floods and cyclones. WASH systems could update their national design codes to require inclusive flood and heat resilient infrastructure and upgrade to climate-proof water points and latrines in both peri-urban and remote areas. And lastly, the study helped identify successful pilots related to food security, child health services, and others that could be further scaled up through women's groups, church leaders, and agricultural extension officers to increase reach and trust of the community. It was also recommended to establish an interministerial climate nutrition task force to help align funding, joint KPIs, and data sharing. Next slide, please. So that's all from me. Thank you, Tomas. Also, a special thanks to the Australian government and the ANCP program, which supported this work, the Vanuatu Ministry of Health, and of course to the wonderful Dakota research team. I'll now hand over to Domi.
Yes, thanks a lot, Tracy, and good morning, afternoon, everyone. So my name is 𝗤𝗏𝗔𝗏. I work with WFP as nutrition resilience and climate expert, and I'm also serve as the co-chair of the GNC Climate Crisis Working Group, which was established in September 2023. So I'll be your facilitator for this panel discussion, and we will really focus on concrete actions that can take that we can take to reduce the climate and nutrition risk. So the session will build on the excellent presentations that we just heard, and that really help, I think, to set the scene and frame the key challenges. So we will have 30 minutes for this discussion, and I will start by posing one question to each panelist, and after which we will have a Q&A session with our speakers and panelists. So please, during the discussion, feel free to drop your question in the Q&A box. And if your question is directed to a specific panelist, please mention it. So other questions will be addressed in the Q&A segment. So I'm really happy to have such a great group of panelists with us today. Each of them will bring a unique perspective from the Asia-Pacific region and beyond. And so with no further ado, I will turn to our first panelist. So our first panelist will be 𝗖𝗵𝗶𝗆𝗍𝗂. Maybe I can invite all our panelists maybe to come online. Yes, great. So Filippo is an Italian food engineer and public health nutritionist with a PhD in nutrition epidemiology. He recently served as the head of the Human Capital Unit at the 𝗣𝗵𝗆 Regional Bureau in Nairobi, where he oversaw social protection, identity management, school feeding, and nutrition. Since joining 𝗣𝗵 in 2013, he has supported nutrition-sensitive programs across Africa and the Asia-Pacific, focusing on integrating nutrition into social protection, emergency preparedness, and climate resilience. His work blends evidence from randomized trials with strategic policy engagement, with a strong focus on sustainable food system and the link between diet, climate, and health. So Filippo, I have a question for you. In the Asia-Pacific context, where do you see the biggest opportunities to embed climate nutrition pathway into 𝗣𝗵 regional climate portfolio?
Okay, thank you, Domitila. Can you confirm you can hear me?
Yes.
That's great. So first
Filippo,
of all,
you have 4 minutes.
4 minutes, perfect. Thank you. Help me to keep the time. So first of all, just to say that I'm speaking on behalf of my team in Regional Bureau Bangkok that I left in August 2024. So bear with me if I don't know the latest development of the work that 𝗣𝗵 has been doing in view of the 𝗣𝗵 2024 policy update on climate, which is guiding basically everything we do. And in particular to work with the food insecure populations, which are empowered to both manage climate risks, but also to adapt to the impact of climate across the world. So during the years that I was in Bangkok, we had the privilege to work with the Asian Development Bank, which is highly interested. That's something which is relevant for all the audience participants today in the nexus between agriculture, climate, and nutrition. So it was really like a springing board to try to tackle all these 3 areas at the same time. To do that, not very surprising, but we wanted to start from evidence, and we noticed immediately that there was quite a big gap. And that's why we requested 𝗣𝗂𝗫 to generate the evidence that they eloquently shared today with us. There is quite a lot at global level. There is more and more at regional level, but Asia and the Pacific was really a big gap. And also let's remember that the impact pathways change according to the different regions, and they should even go at a lower level. So that was only the first step. The second step that we agreed to undertake together with 𝗣𝗂𝗫 was also to generate more evidence based on the data that 𝗣𝗵 jointly with the governments is constantly generating with 5 countries: Bangladesh, Nepal, Philippines, Fiji, and Laos. It was very hard to select which countries because most of them in Asia Pacific were really interested in this concept note, in this type of innovative approach to address nutrition in view of climate shocks. The program has started in 2025, which will go up to 2027, and relies on funding covering approximately $10 million across all these countries. And what we have been looking in particular is really the anticipatory actions. Anticipatory actions very often neglects the component of nutrition, although according to 𝗣𝗶, it's really the low-hanging fruit, because it can really rely on at least two elements. One is social behavioral change communication, both during the preparedness phase, but also during the shock and after the shock. And the other thing is really the transfers. It's true that anticipatory action normally have only one type of transfer, only one, compared to other type of programs in nutrition. But it's very, very important that there where it's possible to offer transfers, either in kind or products, this is really happening on time. The outcomes of the concept note developed with the different countries were MUAC, but also MIMO, adequate diet, and also other individual indicators. That also allowed to look at cash transfer in Bangladesh, while social behavioral change communication in different forms for the other countries. I won't spend more time on the 3 out of the 5 concept notes. What I wanted to say is simply that there were quite a few challenges with the barriers, quite a few challenges with the triggers, trying to integrate nutrition and diets into the triggers of the normal anticipatory action, and also the big need to generate more evidence informing policies for the governments, recipients of this kind of support. Last but not least, good news as well. 𝗣𝗶 is jointly with the methods also developed with the Save the Children, who are with us today, has all the tools also to define the type of transfers using the cost of the diet-based type of tools. I leave it at that, Domitille, not to take too much of a time.
Thanks, thank you, Filippo, for highlighting those opportunities. And so now let me turn to Tracy from Save the Children. So Tracy is a global health practitioner who has spent over decades supporting maternal and child health and nutrition intervention across the Asia Pacific. In addition to her role with Save the Children, Tracy has recently commenced a PhD with the University of Sydney on the topic of child malnutrition in the Pacific. So Tracy, we just heard about your work in Vanuatu. So based on this work, what specific support do frontline workers and systems need to effectively respond to climate-driven nutrition risk?
Thanks, Domi. So firstly, I feel like our research has helped to identify some of these key pathways, but on the ground, that's not clear knowledge to our program teams or to health staff or other frontliners. So firstly, I would suggest ensuring that everyone on the ground is aware of what these key climate drivers and risks are and how it interacts with nutrition, because our program teams and partners are the key assets that we have in developing local contextualized solutions, as well as innovations to respond to these risks. And they're also best placed to know what will and won't work within the cultural and logistical constraints of the Pacific. So, for example, with the need to improve food systems so that people aren't being pushed towards high energy and towards processed high energy, low nutrient foods, our program teams can help to make better decisions when choosing what food goes into emergency food baskets when they're on the ground, including the right nutrition support and the messaging regarding processed foods, which is not currently integrated in that. Or in development contexts, it might mean choosing and promoting more climate tolerant crop varieties or introducing food processing and storage methods. But these need to be acceptable to local tastes, and they need to be reliable at the times that local communities need them across the year. We'll need better low-tech approaches to help communities to prepare and mitigate for changed rainfall, for increasing salinity. Just today, I was talking to a colleague who is an agriculture coordinator in one of our projects. I'm in the Solomon Islands in Honiara at the moment. And he was talking about a local method of desalinating soil. So in coastal communities, some communities have taken to using soil from the mangroves, treating it through flushing and composting to reduce the salt content, and then using it in raised garden beds. So this is something I hadn't heard before. I don't know if it actually works or not, but it seems to be working for this local community, and it could be a low resource and locally acceptable method for overcoming some of these kitchen gardening challenges in increasingly saline conditions. The other side, I think there's also a need for research and data to inform climate resilient project design. So as a health and nutrition advisor, I always have climate change in the back of my mind. And anytime I'm looking at designing new projects, I need to remember, how are we going to future-proof this? So for water projects, where are the areas where we are going to see increasing groundwater salinity or changed rainfall, so that instead of drilling a borehole, we're investing in rainwater catchment, which will make sure that these solutions will be sustainable for these communities. We probably also have to invest in larger storage than in the past. And I think this applies to all the systems where we need to increase resilience and add a buffer space, because climate change is an accelerator for exacerbating so many different pathways. And of course, this is also going to lead to greater funding. So in terms of our frontline workers, we need to be funded to look at these, at the increased scale of the issue of what we're dealing with. Thanks.
Thanks a lot, Tracy. I think it was really powerful to remind us about the real world challenges, and also about, I mean, some locally led solutions that could be really, we can learn from. Let me now turn to our third panelist, 𝗖𝗵𝗵𝗄𝗆 from 𝗔𝘀𝗶. Hi, 𝗖𝗵𝗵𝗄𝗆. So 𝗖𝗵𝗵𝗄𝗆 is a Vanuatu-based researcher with experience in community advocacy, humanitarian coordination, and climate adaptation projects that strengthen local disaster resilience. She supported 𝗔𝘀𝗶 as a national researcher for the regional study on the impact of climate change on nutrition in the Pacific. Her work focuses on community-driven research and evidence-based approaches to advance sustainable development across the Pacific. 𝗖𝗵𝗵𝗄𝗆, same question to you. Based on your recent field work in Vanuatu, can you highlight any promising action at the community level? What additional support is needed for communities to adapt to climate change in a way that protects nutrition?
Okay, thank you, Domi. Thank you, everybody. Hello, Geta, Nemblomi. I'm honored to be part of this panel this evening. I hope you can all hear me loud and clearly. For the question, it's as it is in two parts. I will answer in two parts, and I'll make sure I'm within the 4-minute time. So some of the promising actions that we have seen from the community level is the establishment of conservation areas near coastal areas, conservation areas, as well as the mangrove planting along the coastlines and along riverbeds to ensure the slowing of coastal erosion. Some of the other practices that we had seen was the practice of mixed gardening, planting crops like sweet potato, taro, and manioc with 𝗤𝗫𝗫 plant, which is another root plant that's used for other purposes, as well as planting bananas closer to their homes to ensure that if these root crops were damaged, then they would have the bananas that were closer to the homes, easy access for the families. Some of the other points that were raised as the promising actions was the recognition of the importance of the 3 food group meals, where the the community had come forward and said, yes, we do have the 3 food group meals, and we try to at least get as much as we can with the even when the access is limited. As on the side of WASH, to do with the rainwater tanks, during the dry periods, rainwater tanks were utilized quite frequently, as well as giving pregnant and lactating mothers and children green fresh coconuts to drink as an alternate source of hydration. So these were some of the practices that we saw that were really quite promising at the community level. And some of the interventions that we would like to see for climate adaptation is around the climate resilient agriculture. I think that's something that we have really pushed during this panel discussion, and also as presented earlier with the 2 presenters, how important it is to have the climate resilient agriculture and ensuring that communities are trained and supported, especially around composting. Now we're having more rain, flooding in our communities, so flood tolerant crops, and what does that look like in each community in the context of Vanuatu. To follow up from what Tracy had said, the expansion of clean, clear water infrastructure just beyond the pipes, beyond the tanks. Rainwater tanks is utilized quite frequently, but also can we look at other ways where we ensure that the water in these tanks are tested, if they're using a water pump, that the pumps are being repaired frequently rather than being left, and sores and other sicknesses and illnesses come out from these poor management of water infrastructure. Some of the other interventions that came out that we would like to see is the ensuring that the revival and protection of the food traditions. One of the beautiful food traditions that we had seen was how some communities they rang in the new year with the new harvest of yams, and now that community has been so damaged by the frequent onslaught of cyclones and other climate-related risks, that now they don't have yams anymore in that community. So that is something that we would like to continue to see, to reintroduce that back into their communities, that those food traditions, those customs that they had already been practicing for many years before this. Some of the conversations and discussions that came out was around the mental health support, especially for pregnant and lactating women, for mothers, having them being mentally supported during this time of vulnerability, and ensuring that they have a social safety net. As I'm not too sure if many of you know of the Vanuatu context, the RSE scheme, or the seasonal working scheme, is something that is has come up quite a lot as a way for families to combat this economic struggle that we are going through. So many of the households have now been woman-led households, where the main breadwinner has left the country, and has left the country with all of those resources now, and all of these responsibilities have now been put on to these women, these vulnerable women, these disability women. So there needs to be more health support. There needs to be more health support from the community level, as well as from the national level as well. So I think I won't take up too much of your time. Thank you.
Thank you, Celicia. And yeah, I mean, it's great also as a way you highlight the locally based solutions that could be really implemented with the communities. So let me turn now to our last, but certainly not least, speaker, Dr. Sandro De Maio. Dr. Sandro De Maio took up his position as director and head of the WHO Asia Pacific Center for Environment and Health based in Seoul, Republic of Korea, in February 2025. The center leads WHO's work on climate, environment, and health across the Western Pacific's 37 member states. Sandro brings a unique blend of academic expertise, executive leadership, and global health experience. Sandro, zooming back out to the regional level, what regional policy shift or partnerships could best enable national action to cut these climate-related nutrition risks,
Thanks, Diamond. It's wonderful to join such esteemed colleagues for a rich conversation this afternoon here in Manila. I am in Manila in the Philippines today at our regional office, and it's a real pleasure to be able to join colleagues from across the region and beyond. As you mentioned, I'm new to the role and leading WHO's work on climate, environment, and health across the Western Pacific region, a diverse and fascinating group of countries, from some of the largest countries, China in the north, through to some of the smallest island nations out in the Pacific. We're currently building a new program of work, brand new program of work for the Western Pacific region, focused on the intersection of climate, environment, food systems, and nutrition, with health at the centre. So it's a pleasure to be able to join this and share some of the thinking, but also really reflect back many of the conversations and insights that we've heard over the last hour and a half. And I'll share three opportunities that we've already discussed a few times, but I wanted to highlight as, I think, key opportunities as we think to the future and how we utilize and really leverage food systems as a force for good when it comes to that important nexus of climate, environment, and health. The first is that we need to really leverage both procurement and public policy reforms together, and not see them as separate tools, but as a joint and connected strategy to shift the deeper conditions that shape our food systems. We often we're increasingly focusing on procurement and supply chains, the power of procurement and supply chains in institutions like schools and hospitals, prisons, and even in aged care across the region. And many countries are world leaders in this space, in what's being served and how it's being sourced, and using that as a force for good for health and for the environment. And that's essential. But with that, we need to also make sure that we have the enabling policy environment that allows the foods to be sourced sustainably in a way that's good for people and planet, but also supports the market as it makes the transitions from what we're growing today to what we need to grow in the future, and that de-risks the transition, but also, I suppose, at the supply side, but as well continues to support at the consumer side a transformation in our food environments, and ultimately supporting even local providers, producers, and vendors. The second is that we need to invest in integrated monitoring systems that can collect and connect the right data to really support anticipatory action. Right now, we know that most countries have fairly decent data on food production and trade, but there's far less visibility into how food systems are impacting people's health, especially as climate risks accelerate. And these are major gaps in tracking things like diet quality, climate-sensitive diseases, and the nutritional consequences of food insecurity, pollution, and extreme weather. And so we need to move from siloed surveillance to integrated intelligence, linking food, climate, biodiversity, and health data in ways that support upstream prevention. And we need to connect that intelligence to efforts that strengthen surveillance, both to sudden shocks like floods and heat waves that we've talked about today, and to slower moving threats like rising temperatures, shifting rainfall, and rising sea levels. Regional partnerships can help countries climate-proof nutrition services, forecast risks like climate-driven malnutrition or foodborne diseases, and of course, most importantly, act earlier. And we're already seeing increased focus on connecting biodiversity, agriculture, production, and infectious disease monitoring. In fact, just a few weeks ago at the World Health Assembly, this was an approach that I saw as the world adopted the new pandemic agreement. And this kind of integrated prevention is essential. The regional mechanisms can help embed it more systematically across countries and in a way that's tailored to the needs and priorities of communities and countries across our region. The third opportunity that I see is really that we need to spotlight and support local food systems as drivers of resilience across climate, biodiversity, and health. And we've talked about this a lot today. From local to global, these systems, led by small-scale producers, processors, and vendors, do far more than just feed people. They sustain livelihoods, they bridge rural and urban divides, they ensure access to healthy food for low-income communities, and they provide stability in the face of shocks. We've talked about the westernisation of diets and the acceleration of that westernisation, the commodification of our food systems in the context of a changing climate and increasing disasters. But these local food systems are often overlooked in public investment and policy, which tends to focus on formalised corporate value chains. And I think that's we think that's a missing opportunity. The evidence supports it. Regional policy shifts can help by legitimising and investing in these systems and by creating mechanisms for their inclusion in planning and decision making. And this is also a chance to strengthen youth engagement, bring lived experience into policy conversations, and move beyond simply top-down development models that haven't always served communities well. So in short, I think regional action can, one, align procurement and policy to transform food systems from the ground up. Two, connect monitoring systems to for prevention and early action. And three, lift up local solutions that are already working and are often in need of recognition and support to achieve scale. Thank you.
Thanks a lot, Sandro. Yeah. Yeah, I think, yeah, I mean, you highlighted very important points. And let me now, first, thanks to all our panelists for your very insightful contribution. I think you give us really plenty to reflect on. And we have now some time for Q&A. So I will invite also our presenters, Mary, if you want to come on video so that so that we can answer the question from the audience. So I will invite participants, if you haven't done it yet, to drop your question in the Q&A box. And so I think we have already some questions in the Q&A box. I will maybe pose the first one. I can see there is one asking whether the panelists could share some insight on how we could strengthen and develop climate resilience and nutritionally adequate food system for these vulnerable countries, especially those that have little to no food production and agriculture system in place. And with example from Kiribati, Nauru, and so on. So really looking at, and it's true, we discuss a lot about working on climate resilience agriculture, improving local food systems, but what about other communities that are little or no food productions? Who wants to take this one, Mary? Yes.
Yeah, I see Filippo has already answered for Samoa in the chat box, and he can come in and add. What I thought we could do. Oh, Filippo, do you want to go first? And you can speak to Samoa. I can speak to Kiribati. No. I wanted to speak a little bit to Kiribati, where we supported UNICEF and Government Select Committee a couple of years ago on improving nutrition in general. So I know that the question here was specifically about food systems in a place that has little or no food production or agriculture systems in place. And I quite like to broaden it to nutrition, and obviously point out that yes, Kiribati is a country that is highly reliant on imports, and so how you improve the food system has perhaps looks a bit different. When it comes to the nutrition-sensitive food supply in Kiribati, there are opportunities for intensifying agriculture in specific areas. There are opportunities for promoting and supporting community-based initiatives for seasonal local food production and preservation. So egg production, home gardening through localized decompost, and homes and schools through and to bring it to homes and schools. There's also options for promoting suitable and effective irrigation and land reclamation practices through hydroponic farming and marine farming innovations. However, a lot of the issues for countries such as Kiribati comes under the creating an enabling environment and actually using tools in terms of controlling imports and moving more along there, because in many Pacific island countries such as Kiribati, obesity and NCDs is such a huge problem. So the adaptation to climate change and protection of nutrition will look quite different in these settings. So I'll stop there just to kind of, set that scene. Thank you.
Thanks a lot, Mary. Filippo, do you want to complement what, yes, with your example maybe from Samoa?
No, sure, yeah. So I remember something like a couple of years ago, our colleagues from 𝗣𝗶𝗆 Samoa calling for a brainstorming about really what to do to support the government. The government was totally in favor to do something mainly about obesity. Not necessarily related to climate shock, but climate shock was also part of the discussion. And what really resonated a lot beyond all the guidelines that the different UN agencies had pulled together was to start from data from the government. Data from the government about, if it's about nutrition, looking at the cost of the nutritious diet, and helping the government to really prioritize certain activities over other ones. So unfortunately, as I was saying in my answer, I left before the process was concluded. So I don't really know which kind of angle, which kind of food system, health system, protection system, education system, or fishery or agriculture system was prioritized. But I would strongly recommend the colleague to get in touch with my colleague in Samoa, and I put there the email. Over.
Thanks a lot. Maybe I have a follow-up question to this one, because we start discussing about obesity, and it was also highlighted in your presentation, Mary, and by also other speakers, that there is currently a lack of data on the impact of climate change on overweight, obesity, and NCDs. So any insight of on how we could start building this evidence base and how we can really address this evidence gap related to obesity, but also to gender and urban inequity. Filippo, yes, I mean.
Maybe just, again, I'm not an expert in this area, but definitely the impact pathway designed by 𝗖𝗂𝘁 was quite useful, definitely for the years to come in terms of understanding better this process. But also would like to remember that the Oxford University has got a center of research in Nauru. So maybe also worth to get in touch with them. I can't remember the name of the researcher there, but they are looking specifically at obesity, and I'm sure that they have also some insights about climate shocks. Over.
Thanks, Filippo. Any other insight from our panelists how to tackle this evidence gap related to climate and obesity or overweight and NCDs?
Maybe I'll just come in quickly, and I think
Yes, please.
𝗖𝗵 maybe also has some thoughts. But I spent 15 years of my life working in NCDs and obesity prevention, and now I've spent the last 3 months working in the climate and health space, and the bridge was food systems. And I think, first of all, the kind of double or triple duty actions that are inherent in food systems responses shouldn't be overlooked, from breastfeeding in earlier stages of life all the way through to, and first food environments, through to food system interventions. You know, we know that they have win-wins for both undernutrition and also stunting, wasting, anemia on one hand, but also absolutely overweight, obesity, and in fact the double burden of malnutrition, where you have overweight and obesity, but also micronutrient deficiency because of calorie dense and nutrient poor diets, which often arise from the dominance of ultra processed foods, which we know relates to cost and access and affordability of good food, particularly in the Pacific, exacerbated increasingly by food insecurity and the direct and indirect causes, results of climate change, including sea level rise, but also other extreme weather events and catastrophes. I think the other thing to say is that a lot of data actually exists on NCDs. Many countries collect data through what we call comprehensive step surveys. I designed the first step survey for Mongolia, for example, about 20 years ago. And these are quite comprehensive data sets, looking at everything from anthropometric data to biochemical data, and WHO supports that in most of our member states. I think the challenge is more around connecting rather than collecting the data. And it's making the data into intelligence rather than it just being numbers that sit on separate shelves and never talk to each other. And it's making sense of that in an integrated way across parts of government, across NGOs, across even UN agencies. And I think that's something that we need to be better at, is connecting these different data sets and making more sense of the data we have, as well as obviously filling gaps.
Thanks a lot. Yes, clear point about, all data are collected, but how we use them really. Yeah. I think we had another question on the Q&A box. Was a question about, could you please shed light on how we can make progress on equity? So a bit quite a broad open question. Anyone we want to share some insight?
Well, maybe, I mean, I'm sure everyone's got, it's almost sort of too much to say. It's all of us running at the door at once, probably. I think, equity really is the big and the most important question. We know that inequities are being exacerbated, and we heard very powerful, I think, summaries of that from Tracy and 𝗖𝗵 and Filippo and even Marie earlier in the presentations, whether it's gender or poverty or even disability. Inequities and the intersectional nature of inequities are being exacerbated by all of these challenges, both in terms of food access, affordability, and being able to enjoy a nutritious, good diet on a normal day, let alone then, of course, we know that the compounding effects of climate change make that even worse. I think many of the interventions that we've been discussing, from supporting local food systems, from social protection systems and how they relate to our food environments, making sure that we're asking these questions up front. I think many of the conversations today have been absolutely focused on equity, as they should be. It's how we go beyond sort of equity as a headline to then really thinking about what forms of equity and how does it actually operationalize. And I'll hand over to others who are more expert at that and have talked a little already about that today.
I can add. I'm not an equity expert, but we made sure we interviewed those who were in this process, and I think as mentioned in the presentation, it's important to include these marginalized groups in the design of interventions. And to make sure that they're meaningful for these groups, and ensure that we promote, let's take gender as an example, gender equity through better access to economic resources, and education and training, and to the very specific kind of constellation of issues experienced in Vanuatu, I can maybe hand it over to Celicia or Tracy, because it is quite a unique situation with the women carrying a very, very heavy burden. Thank you.
Thanks, Mary. I think, well, we will need to wrap up now the session. So thank you a lot for your insight. I think there are a new question maybe in the chat box. We try with Q&A box. We will try to answer it by writing. So let me first thanks a lot again, our speakers. I mean, I think both the presentations, the panel discussion brings very practical, actually, insight, both from evidence, but also really from operational perspective on what could be done. And so I will just share a few takeaways from the session. The first, I think, is about the urgency of action. So we were reminded that climate change is already happening, affecting nutrition outcome, and it is proportionally affecting those who are the most vulnerable, so like children, women, and food insecure communities. The second is about evidence, and so we were told, yes, there are evidence on climate and nutrition pathway, but also there are important gaps in terms of evidence and data, and we need to address those gaps, but also make sure that we translate this evidence and data into actions. So I think it was also the message from Sandro saying, okay, we do have sometimes data, but we are not using them and we are not linking them to other data in order really to generate information to inform policies and programming. We heard also about the importance of integrating nutrition into climate risk assessment and policy planning, and also the importance to invest in early warning systems that address that take into account nutrition vulnerabilities. The good news is there are solutions that exist, and they cut across different levels and time frames. They range from low-cost, short-term interventions that like integrating nutrition messaging, or working on adding improved cash transfer in anticipatory action framework, to something which is more a long-term transformative actions that and strategies that really integrate nutrition into national policy related to climate resilience, climate adaptation, food system, and beyond. Important point was made about how localization and climate agenda are interlinked and might be addressed together. And I think this is really timely as the GNC is working on this new 4 or 5 year strategy, and it has already placed a strong emphasis on enhancing localization efforts. So really it's about recognizing the key role of local actors and system in driving effective actions. Equity, it was mentioned, and yes, important to have this equity lens front and in the center. So we know that climate shocks within gender, disability, and urban slum disparities unless every intervention linked to an equity indicators. And my last point would be around partnership and advocacy. Both matters. So we need to strengthen multi-sectoral collaboration from local really to regional and global level, and make sure that to elevate nutrition within climate financing and policy spaces, and also global nutrition climate discussion. So yes, we need to make sure that nutrition actors are stay visible and vocal in those spaces. So just my final announcement is just to let you know that a new brief will be soon published about the relationship between the climate crisis and nutrition in emergency. It has been developed under the framework of the GNC Climate Crisis Working Group, and with the support also from 𝗔𝘀𝗶𝗆, so from the Columbia Climate School. So please stay tuned. It's going to come very soon. With that, I just want to thank you again for your active participation in this webinar. Thanks again, our speakers. And I hope we can stay all together and to push forward this important agenda around climate and nutrition. Thanks.
Thank you, Domi. Appreciate that. Special thank you to Dakota, SAVE, WFP, and WHO as well. We've really appreciated your time on this webinar. If you are looking for support in nutrition emergencies, you can always reach out to the GNC or to ENNet for peer support. If you go to the next slide, you'll see a picture of the GNC here ready to support you and where that request button is. And then just one final slide. After you close the webinar, you should receive a pop-up for some feedback. If you can quickly provide us some feedback, we would greatly appreciate it. But huge thank you to you all for a very inspirational webinar. Really appreciate your excitement and your enthusiasm about this huge issue that we all have to come together to address. Thank you so much and have a good rest of the day.